So let's talk about what you should do if you're on GLP-1 agonist medications like Tirzepatide and Semaglutide. My name is Dr. G, and I'm an internal medicine doctor here in Hollywood, Florida, and I have experience consulting on medications such as Tirzepatide and Semaglutide on a daily basis for the purposes of weight loss and diabetes control. So by now, you've probably already seen my other video, 11 things you should not do on Tirzepatide and Semaglutide, and if you haven't, I invite you to take a look at it. But right now, let's talk about 10 things you should do. The first thing, when starting out on these medications, you should be monitoring your blood glucose levels. I know I've said before that they usually don't cause hypoglycemia, but that doesn't mean it can't happen. So at the very beginning, when you're starting on the medications and starting to get the feel of what it's going to do to your appetite, you should be watching what your blood glucose levels are doing, especially if you feel like you're dragging and really aren't getting much calories in. Blood glucose levels can fall a little bit relative to what you're used to and can be the cause of relative hypoglycemia. Not really low blood glucose levels, but lower than you're used to. The remedy here is to take on maybe some fruit, smaller meals, just something to get you over the hump while you get used to the medications. The next thing you should do is to be very vigilant of side effects. Which side effects? The most common ones: GI side effects, gastrointestinal side effects, nausea, vomiting, and diarrhea. Sometimes the symptoms are not as obvious. The gastrointestinal side effects can come on very slowly, and the key is to let your provider know they're happening so they can get ahead of it. Very rarely are the gastrointestinal side effects from GLP-1 agonist medications severe enough to cause you to need to stop the medication, especially if you let your provider know early. For instance, constipation. Constipation can happen at any time on the medication, and as it's starting to build up, your provider can provide you with tips on what to do in order to promote a bowel movement, and you can continue on with the benefits of the medication. I know I've said this many times before, including on my video on 11 things you should not do, and I hit it on the side of don't let yourself get dehydrated. But what you need to do is to hydrate yourself. Make sure you get enough water to drink. There's a couple reasons why this is necessary. Number one, another side effect of the medication, possible side effect, not as prominent as the gastrointestinal side effects, is dehydration. The medication actually causes the kidneys to waste salt, and as it's doing that, or sodium, as it's doing that, you can't just pee, salt like out of a salt shaker. You have to urinate water with that. So it can promote dehydration in patients that are susceptible to this side effect. So it's important to continue to hydrate yourself throughout the dosing of this medication while you're on it. That's one reason. The second reason is water is necessary for the breaking down of fat tissue, for breaking down triglycerides specifically. Hydrolysis is called, where H2O or water molecule comes in and helps to split off the triglyceride molecule down into its simplest form and basically get you to break down the adipose tissue as you continue to lose weight. So water is necessary for the breakdown of fat. Also, the medication has been known to lower blood pressure. So water is going to be needed to help you to stay hydrated and keep the vascular space robust and keep your blood pressure up in a lot of patients. Here's one you might not like, but it's necessary to talk about. Stay away from overdoing it with alcohol. Alcohol can lower your blood sugar. Paradoxically, it has an effect where you misuse blood glucose and your blood sugar can drop. So that's not a good idea with a medication that can also drop your blood sugar. And number two, alcohol in and of itself is not a great substance to put into your body, especially when you're trying to lose weight. Alcohol tends to, first off, it's an empty, terrible calorie vehicle to put into your body. It's very simple, and you can't really use those calories efficiently and for any real purpose. And the other reason is alcohol, for some reason, has us to make poor decisions on food in general, on dietary foods, and we pick the foods that are generally not as nutritious when you're having had a few drinks. So staying away from alcohol is going to help you with your weight loss anyhow, and possibly can keep you away from a side effect of a low blood sugar in an additive effect with the GLP-1 agonist medication. Eat a diet that is balanced, well proportioned, and has a high value in protein intake. Protein intake is going to be necessary on your weight loss. We've already covered in other videos how GLP-1 agonists have a tendency to have you lose massive amount of weight, fast weight loss. Covered it in our muscle video, or muscle loss video, or our lean muscle mass loss video. Do GLP-1 agonists cause lean muscle mass loss? So the medications themselves don't, but actually losing weight may cause you to lose lean muscle mass. So we counteract that two ways. One is making sure that we are intaking enough protein into our diet, in many cases more than you would possibly do or use or take into your body normally. And that's going to help you to keep from breaking down the muscle mass too much, while you increase the muscle mass with resistance training. So it's twofold. One is increasing your protein intake, and two is the resistance training that's on the back end to build up the muscle. All of that comes from a well-balanced, well-proportioned, well-portioned increased protein intake in your nutrition intake. Monitor your weight. Don't be afraid to jump on a scale on a periodic basis. I'm not saying to get on there every day, twice a day, or even every other day. It's not necessary. But on a weekly basis, it's not a bad idea to get some objective numbers as to what your progress is. The weight is part of the goal setting. It's not the whole thing, but it's a good, decent part of why you're doing what you're doing. So it makes sense to don't neglect jumping on the scale and writing down what is going on with your body. Not only that, measuring your waist circumference is also going to be helpful. If your weight is not really moving, maybe you can, by measuring your waist, you will see that the weight is moving around, which is very often the case here in my office. Patients come in and have not lost much weight from one week to the next. Maybe that's a week they've only lost 2 or 3 pounds. They feel a little bit dejected about it, but we always raise their spirits by showing them, hey, your waistline is down 2 inches. And I saw it when you walked in the door, which is the truth. We're not lying. We're telling the truth. And it's noticeable. It's noticeable when they walk in. You can see it on their face. The weight begins to move around, even though it's not coming off for that week. And then invariably they come back the next week, they're down 4, 5, 6 pounds maybe, feeling great, happy, smiling. So do not neglect jumping on the scale. It's just gonna give you some more information as to what is happening with your body. Very important to monitor your workouts. Be truthful with yourself and your journey, and make sure that you're monitoring what you're doing and how much the physical output is, because that's going to be a very big determinant on whether or not you are going to be losing weight and putting yourself in a deficit. It's not necessary always to put yourself in a caloric deficit from the intake standpoint. You can put yourself in a caloric deficit on the output standpoint by just increasing your activity level and leaving your caloric intake the same. There's 2 ways to make that imbalance, right? Input minus output equals whether or not we're going to up or down. So if you're not putting out that output, that input is really, you can lose weight, but it's not the best way to lose weight. It's better to go ahead and change your lifestyle and adapt a lifestyle of good nutrition and a good output with activity level on a regular basis. So track your workouts, see how much you're putting out, see what you're doing, see if it's not working for you so you can change it or modify it, or just switch it up. Maybe your body you may get used to some things, and we'll talk about that in a minute, and it will respond once you change things up a bit. So monitor your workouts. Here's an important one. It's coming across from a lot of questions that I've gotten in the comment sections of a lot of my videos. And the question is, the concern is the plateaus. And I say, celebrate your plateaus. Very important. Plateaus mean your body is adapting to the way you're eating and the way your activity level is beginning to affect your efficiency at burning these calories. This new you at this new weight is a plateau, and we have to work through them. Everyone is going to hit a plateau. If you have questions about plateaus, see the plateau video. And let's see if you can find a way to work through this inevitable milestone. They are milestones. These are to be celebrated. Think about it. Your goal, your weight loss goal, let's say you're 250 pounds and you want to drop, to 190. You have a weight loss goal of 60 pounds. That 190, actually, and you don't wish to go any further down or up, you want to stay at 190, that's literally a plateau. That's what we want. We're looking for a plateau. So the plateaus that you have in between are frustrating because those aren't the one you're looking for. So continue to work through them. Celebrate the ones you're getting to because it means you're working, your body is starting to feel it and it's starting to say, hey, please don't work me down to zero. I don't know where we're going, but I'm trying to save us here. No, you need to work through it. Either increase that activity or change the activities you're doing, or decrease the caloric intake, or increase your proteins. There are many things you could do with the nutrition side. The point is, plateaus are to be celebrated because it means that your body is beginning to adapt and is beginning to change. And the plateau at the final plateau is what you're looking for anyhow. So I love to celebrate plateaus. Remember, this is very important now. Remember, be patient. You didn't get this weight overnight. I do consults like this on a daily basis, and never once has anybody said to the question I asked everyone, when was the last time you were at X weight? Or when was the last time you felt good about your weight? No one says yesterday. No one says last week. Everyone invariably says, more than 12 months ago, more than 2 years ago. It was 5-6 years ago. It was before this kid. It was before this job. There's always some sort of event where they were fit or they felt great, and then something happened and it changed their lifestyle up, and here we are. So that was a long time ago. You're not going to lose this weight today. You're not going to lose it next week. It's going to take time to change your lifestyle, change your nutrition, and change your activity level to meet your needs to lower your weight significantly, little by little, to get to that final plateau that you're looking for. So please be patient. Don't skip any steps. Don't take on any extra medications. Don't do a drastic diet change or, any of the fad diets, because it's going to invariably fail when you get to your number or close to that number and you try to go back to another lifestyle, to your original lifestyle and maintain this new weight. It's not going to work. You have not built up the skills or the new lifestyle changes or the new great habits you need to keep this weight off. And that can be very frustrating when you start to yo-yo and go right back up or nearly back up to the weight that you had before. So be patient, all right? It's gonna take a little bit of time. And here is the last but not least, and my favorite thing to do that when you are on semaglutide, tirzepatide, or any of the GLP-1 agonists, or on your weight loss journey in general, ask questions of your medical provider. Learn what you need to learn. Learn the necessary skills that you are going to need in order to manage your nutrition and manage your workouts and your new activity levels to the point that you are become an expert at it for yourself. You don't need to become an expert to do consults like I do. You just need to be able to manage your own life, your own barriers and your own the things that get in your way on a daily basis. The skills that you need in order to find and fine-tune problems out of your weight loss journey or your lifestyle change journey. So ask questions. Be one of the people that, could come in here, and I have them every day, and I love to have them where we sit down during our consults, our lifestyle change consults, and I get a book open and they start asking me questions. Questions are great. This is a learning experience for you and for me and for everyone else on the journey to see how you can become a better version of yourself. So those are 10 things that I recommend that you do on tirzepatide, semaglutide, or any of the GLP-1 agonist medications in order to be successful. Remember, we do personalized and group lifestyle modification sessions. The link is down below if you'd like to get some more information on how to jump in on one of those, and I will see you very soon.